let's talk about compulsive sexual behavior disorder. There's a lot of controversy here, okay, because it's a very complex and unique disorder. Unique meaning it's different for everybody, which is part of what makes it so complex. So one point is professionals don't even agree on what to call it. Some people like to call it porn addiction or sex addiction. Some people hate calling it addiction and want to call it, for example, compulsive sexual disorder or an impulse control disorder or sexual behavior, sexual dysfunction, not otherwise specified. We professionals have all kinds of diagnostic codes to reflect this kind of behavior. So I think it's important to recognize that the controversy is here. No one's arguing, is this a problem for some people? But people certainly are arguing about what to call it, okay? And another thing that people are arguing about is what defines compulsive or addictive behavior. So how much porn is too much porn? How much sex is too much sex? How much masturbation is too much? And of course, everybody has a different opinion about that. So for example, we have research that shows college men, about 40% of them will masturbate every day. Some people think that's a high number. Some people think that's not a surprise at all. Within that same sample, about 4% of college women masturbated every day. So we tend to see, very much tend to see more of this kind of compulsive behavior in men, more in men than in women. But at any rate, the question is, how much is too much? So let's talk about the use of porn. So people use porn when they masturbate. So what we're really talking about is how often people masturbate. Now, there was an interesting study published in 2023 about the popularity of certain websites in the U.S. And they looked at many websites and really just sort of the numbers of people that looked at those websites regularly. And out of the top 11 websites, 3 were porn. Okay, out of the top 11 websites people went to, the data was probably collected in 2021, maybe 2022. In the top 11 websites that people went to in the US, 3 were porn. So that shows you how popular porn viewing is, which shows you how popular masturbation is. Masturbation is a very popular pastime. Okay, so that, however, leads to one of the controversies of compulsive sexual behavior is how much is too much? When do we call it a problem? And everyone has a different opinion of that. So the bottom line, I think, with people truly struggling with a compulsive sexual behavior or compulsive porn watching, is it's important to figure out, for a professional to diagnose or determine what feeds that compulsive behavior, okay? And that is different for everybody. So people can engage in compulsive behavior for all kinds of reasons. And for the most part, someone's not going to get relief from that disorder, from that diagnosis, unless it's understood what motivates that behavior in the first place. Okay, so all kinds of things can motivate it. People can be depressed, and that depression can motivate masturbation or sex. So depression can motivate masturbation because it gives people some time out of their heads and sort of out of their sadness and focused on something that feels good to them. Or mania can motivate compulsive behavior because people are manic, and oftentimes sexual behavior is associated with mania. Attention deficit disorder can feed or motivate compulsive behavior because people they need more stimulation, and so they're always looking for ways to stimulate themselves. But other things too, narcissism can promote or kind of feed compulsive sexual behavior. If someone's narcissistic, they don't really focus on other people's feelings, just their own, and they might be more apt to engage in a compulsive behavior. Maybe they have an avoidant personality disorder, meaning that for them it is really scary and uncomfortable to connect intimately with another human being in a kind of like a regular way. So for them, they feel safer having sex with a bunch of different people. Now, I can go on. There's a lot of different sort of issues that can feed compulsive sexual behavior. And often it's a variety of reasons. So it's not uncommon for me as a sex therapist to work with somebody that has a variety of issues that led to a compulsive sexual behavior. So for example, untreated depression. And depression, so in men, depression doesn't have to look like, oh, they're laying on the couch all day and they're crying. I mean, depression can appear in many different ways for men, for everybody really, but we're talking more about men right now. So let's say untreated depression, untreated attention deficit disorder, and then maybe an avoidant personality style, which makes them uncomfortable connecting with another human being. You see, that's very complicated. And oftentimes when I'm working with someone who has a compulsive behavior disorder or a compulsive sexual behavior, I'm working in conjunction with a psychiatrist who's prescribing medication. So we diagnose this person, we understand the complexities leading to this behavior, then they're put on medicine, and I work with them as well. So it's it's a complex kind of treatment. It's not like one size fits all. It's not like, oh, you do this and then this is how we treat it. It's complicated. So it's often meds and therapy. We know that folks that engage in more compulsive sexual behavior, they tend to have a higher libido anyway. They tend to see more things as sexual in the environment anyway. So, you know, they would watch a movie and see scenes as sexual that other people may not. So they're kind of in their own way a unique population in some ways. So again, the bottom line here is there's a lot of controversy, but that doesn't mean there isn't very real pain that's associated, emotional and sometimes physical, with compulsive sexual behavior. So it's important to get good treatment. And this video is just explaining why it can be difficult to find good treatment. It's important to find people who have experience with these issues so that you can get, if this is your concern or your loved one's concern, that they can get a solid evaluation and some good help.